Hey there. It's October 30th, 2018. I just wanted to record this video because I searched for an upper jaw surgery and really couldn't find a lot. And I figured if I was searching, there was someone else who was looking for it too. So a little about my journey to here. My operation is in 2 days. It's on the 1st of November. So I just wanted to tell you a little bit about the journey and some of the things to expect, some of the things they're telling me for pre and post and the nutrition and whatnot. So first of all, I've been in braces since March of, well, it's this March coming will be 2 years. So it was 16. 17, 18. Anyway, and I have an underbite, if you can see it there. And what they tried to do with braces, or what they were hoping or attempting to do, first of all, of course, correct the teeth. And second was actually see if they could bring the teeth out or back or whatever ones they had to adjust to make the bite better. Unfortunately, they couldn't do it, and they said that it was probably a 90 to 95% chance that I was going to have the surgery. So I knew that going in. My orthodontist was very clear on that, and she's fantastic. So I'm not making a complaint or anything. I'm just saying that that was one of the things they were going to try to do. So fast forward to a year and a half, and I have my date for surgery. And there's, of course, when you know that you're going to have surgery, you're looking everywhere for some information. And unfortunately, I couldn't find it. I found one video and it was dated a bit, and it was on upper jaw surgery. So I'll fast right forward to the consult. A week ago, I had a pre-surgery consult, and that was at the surgeon's office. And what we did from there, we went in, registered, and they did a um, a little consult where they did some measurements up and see how my lip was. They talked about the surgery itself, what to expect, um, the options that they had, and I'll get to that in a second. And they talked about, of course, all the precautions and all the things that can happen in a surgery, just so you know, and that's normal for any surgery you have. And from there, I went with a lady who took pictures of everything. They spread your mouth apart. They get pictures. They do profile pictures. From there, I went to a molding center. Now, this was interesting because they get a plate and it's shaped like this, and they put gel in it or some kind of material that gels, and they put it in your mouth. You have to leave it there for 20 seconds. Unfortunately, it's not a pleasant feeling because it feels like it's in the back of your throat, and my gag reflex wasn't really the best. So that wasn't really comfortable for me, and they did upper and bottom, and of course they had to do it twice just because I loved it so much. And from there, but the mold hardened to a almost like a gel, like a soft gel. It was really interesting. Um, so anyway, they did that was one of the ones they did, and the reason they had to do two is they actually do surgery on those molds. So they take them and they look at them and they cut them in whatever ways they have to, like as if they were doing a real surgery. And then they know where everything pieces together. So they look at their measurements that they've taken when I was in there earlier, like when I first went in and they did their measurements, and they piece it all together. And these guys are brilliant. So I went into that mold section, and then I had to go up to they take you to the financial person to see if your insurance covers it. Then you go to the nurse's station up on the floor where surgery actually is. And they run through a bunch of tests, just vitals, basically. There's an interview on if you're on any blood thinners or that kind of stuff. And they weigh you, and they do blood work. And then they actually, you talk to your anesthesiologist. and the anesthesiologist goes over some things that are just a little bit not normal in any other procedure. Like if you have an operation on a shoulder, a leg, or whatever, they put the oxygen down your throat and tubes and whatnot that they need to um, do for down your throat. With this, where they're operating on your upper jaw, and they have to put a suction tube up one nostril, which goes down into your stomach just to pump anything out. Like, of course, there's going to be blood and whatnot, so they probably clear that out before you wake up. And the other thing is they have another one on the other side for oxygen, just to make sure that you're getting the oxygen that you need to the vital parts of your body, because your mouth is actually wired shut when this is done. And you got to talk like this, and your nose, you probably, it's like you have a really bad cold. It's plugged up. The tubes are up there, but you really can't, you can't use it as a breathing to get all the pure oxygen that you need. So what they are going to do with me is they are going to cut on the inside right across, up from one side to the other, right across on the upper, and they're going to cut right in the middle back to that cut. And they're going to lower one side up with the other, like they're going to really make it fit, and they're going to put plates here and plates here. And that is to hold it in place until the bone grows over it. Some of the things they were telling me was that the swelling, I'm in the hospital for 3 days, 4 days. I go in on Thursday, and I'm there Thursday night, Friday night, Saturday night, and they're hoping to have me out at 11 a.m. on Sunday morning. That's the discharge day or time. So some of the things that they went over was okay. So I finished at that nurse's station and went back down to the surgeon's floor to where his office was, and he actually had the molds there, but he never showed the surgery. But he had some harder molds, and what he did was he took them and put them together and showed how the bite should be, explained how the bite should be, and said some things that he had to do for my mouth that's a little different than everybody else, or everyone's case is different. So he just had to do, like, file a tooth or something like that to make it fit properly. And what I'm told is that the surgery takes around 2 hours. And my surgeon's pretty funny, because he said, you know what? I said, how long is this going to take? So around 2 hours. I go to, recovery, and he goes, yeah, 2 hours, but don't hold me to that. Like, he was kind of funny that way. He told me he was going to cancel his poker game the night before. So he's pretty good at that. And that was quite comforting to know that I could at least joke around with him a bit. And so all the doctors there made the visit very pleasant. Even the lady who was doing the molds, when I was going like gagging, she was talking to me, breathe through the nose, that type of thing, and encouraging me, just because it hardens pretty quick. So it's like 20-24 seconds, but when you're in that feeling, it's not very pleasant. So the surgery will take it says 2 hours, but it depends on what they run into when they get there, and recovery's around another 2 hours or so. The swelling usually, so you go into recovery, and the swelling usually peaks at about 3 days, and then starts to go down over the next 3 to 4 weeks after that. And they said you're going to look like a beach ball, not like you picture the chipmunk when they get the wisdom teeth out. It's not like that. It's like this, but of course everything is swollen. Your nose, I mean, they have to go up and put plates and stuff, so you're going to be pretty swollen, which is expected. I've seen some where they actually put a band on your head with ice packs on the side, so it holds on your head. It looks like you're wearing headphones, but on your cheek, kind of thing. And so I think that covers pretty much the whole surgery. You go. I'll explain a little bit more on the nutrition side and whatnot, but it can't have anything hard for a long time. So it could take, for all the swelling to go down, who knows, maybe 6 months, maybe. But they said it'll take a couple of months for the swelling to go down. Like you'll notice stuff and other people won't, but you'll say, hey, I'm swollen here and that type of thing. But they said, normally it would be around a couple of months for sure. Um, and so on the nutrition side, they they gave me three options, and they said, your mouth is gonna be sealed shut with elastics. You're gonna have to breathe through your mouth like this and talk, and they'll cut elastics off as they need to open it up a bit. But for the first 3 weeks, you're probably going to be like that, at least two for sure. And the first 3 weeks is a liquid diet. And what I've been told is that there's a big syringe, like it's a huge syringe with a straw on the end of it because you can't suck anything. So a straw on the end of it, and they put well, whatever the fluid is, and push it in like a syringe, like in through the side, and the straw pushes it down your throat, I guess, but in your mouth anyway. It's liquid, you can swallow it and whatnot. So it's not as bad as it sounds. Like they don't push it into your throat, but they get it in your mouth, and you just go swallow like as if you were drinking of a water fountain kind of thing, and it was just running down your throat, sort of thing. But some of the things they recommended, and here's where it didn't sit well with me. Um, some of the things they recommended was Boost, Ensure, and Carnation Breakfast. Now, if you looked at the nutrition on those, it doesn't really sit well with me. And we have our own nutrition, and I was quite happy with that we're already doing meal replacement shakes from the nutrition company. And so we're really happy with that, and I think I will have way better nutrition than those three things, um, because mine is a complete meal replacement. So it's liquid diet for 3 weeks, and then it's blended soft food diet for 3 weeks. Um, and that means that everything, like even if I had soup and it had like carrots and whatnot in it, I would have to throw it into a blender and actually blend it up and eat it like baby food. Basically, it's a baby food diet for the next 3 weeks. So I won't be chewing anything for quite a long time. Like I said, it's October 30th, so that puts me into Christmas. So my Christmas dinner is going to be in a blender, basically. Um, I think that's it for the overall what they gave me. Now I have on my teeth to keep since I have an underbite, to keep it from hitting the upper brackets. I have acrylic in the back on my back, so it doesn't let me bite all the way down. And I've been dealing with that for the last year and a half, where sometimes when I go to close, they put so much on that it's like this. I can't even chew anything. But anyway, that's coming off tomorrow, and it'll be the last time I have it on, because the rest of it's going to have my jaw's going to be, I won't say wired shut, elastic shut. So it's like it's wired shut, I guess, but they're using elastics. They give you a pair of scissors. If there's an emergency and you have to cut the elastics off, you go with a pair of scissors. So they make sure that if you really had to cut them. So I asked about being sick and whatnot if I get sick, and they said, well, there's only fluids down there, so if you get sick, just lean up and let it come out through the gaps in your teeth. They said there's a lot of gaps. You think you won't be able to do that, but they said don't worry, you will. Like it'll come out. They went over how the nose is going to be swollen and bloody, and there's a certain amount you can't be blowing your nose. So the tubes. This is what concerned me a little bit too. So they said they will take the tubes out when I start eating before I leave the hospital. So I have to be able to eat or get this syringe full of ours is a meal replacement shake. So I can go over that in another video on what that actually is, if anyone is interested, because it's actually a nutrition dense meal replacement shake, and that's what you don't get from the other three, is that. So that pretty much covers it. It's 15 minutes into this video now, so what I'm gonna do is I have some pictures taken of the day that they actually did the molds and put them together, and the doctor was there, or the surgeon, I mean. I'm gonna attach those in the video here somehow, and I'm gonna do recordings when we get to the hospital and whatnot, and just some of what I'm going through or how I feel, maybe if I'm up to it. I might need an Ativan for that. And my wife is going to, as soon as I come out of as soon as she's able to see me post-surgery, she's going to get some pictures, maybe a quick video, and say, this is just an out of recovery or whatever, just so you guys can see what's going on. And it's really, if I was, like I said, if I was asking those questions, I really thought someone else was, and I thought I could help some people by just showing them what I'm doing. And I'll show you the shakes and what I'm doing when that comes about too. Um, and as the recovery goes on in the months and stuff, I'll certainly take more videos, and you'll have access to all that stuff. So, and if you have any questions, I'll have my contact info here too, or it's on YouTube now, so you're watching it and you'll be able to contact us there somehow. But yeah, if you never have any questions, by all means, please reach out to me, and I'll have my contact info in there. And that's basically the first video that I'm doing, just on what to expect, and I'll tell you how I'm feeling, those days, and I'm sure my better half will be filming, and I'll be with her thumbs up or not, or I'll write something down. I'm pretty sure the first couple of days I'll be out of it anyway, but I'll certainly try to get some